take it in, but don't look down.
'Cause I'm on top of the world, eh? I'm on top of the world, eh? Been waiting on this for a while now. Paying my dues to the dirt. I've been waiting to smile, eh? Been holding it in for a while, eh? Take you with me if I can. Been dreaming of this since a child. I'm on top of the world.
I've tried to cut these corners, try to take the easy way out. I kept on falling short of something. I could've gave up then, but then again I couldn't have. 'Cause I've traveled all this way for something. I take it in, but don't look down.
'Cause I'm on top of the world, eh? I'm on top of the world, eh? Been waiting on this for a while now. Paying my dues to the dirt. I've been waiting to smile, eh? Been holding it in for a while, eh? Take you with me if I can. Been dreaming of this since a child. I'm on top of the world. 'Cause I'm on top of the world, eh? I'm on top of the world, eh? Been waiting on this for a while now. Paying my dues to the dirt. I've been waiting to smile, eh? Been holding it in for a while, eh? Take you with me if I can. Been dreaming of this since a child. And I know it's hard when you're falling down, and it's a long way up, and you make the ground, but get up now, get up now. And I know it's hard when you're falling down, and it's a long way up, and you make the ground, but get up now, get up now. 'Cause I'm on top of the world, eh? I'm on top of the world, eh? Waiting on this for a while now. Paying my dues to the dirt. I've been waiting this long, eh? Hold me there for a while, eh? Take you with me if I can. Dreaming of this child. I'm on top of the world.
You can be amazing, you can turn a phrase into a weapon or a drug. You can be the outcast to be the backlash of somebody's lack of love. Or you can start speaking up. Nothing's gonna hurt you the way the words do when they settle need your skin. Kept on the inside and no sunlight, sometimes a shadow wins. But I wonder what would happen if you say what you wanna say and let the words fall out. Honestly, I wanna see you be brave with what you wanna say and let the words fall out. Honestly, I wanna see you be brave. Just wanna see you. I just wanna see you. Just wanna see you. I wanna see you be brave.
My world, our world, may keep changing, but I'm not going to let the days blur together anymore. This is my awakening, my call to bounce back, to thrive. I stand for those who make up the fabric of my life, where I come from and where I'm going. I stand for my community and for myself. My mission is to change the word challenge to opportunity. And my goal is to live without limitations. Let's make a declaration together. Our future has no boundaries, no limits, no ceilings. I'm opting in, signing up, and using my voice. Today is the day I recommit to my shine, to digging deep for inspiration, to reaching out when I need help and when I can give it, to ensure that all of our voices are heard and the person behind each voice is served. For myself, for my community, for our health, and for so much more, because my promise is to live fierce every day. There is strength in possibility, strength in numbers, and new opportunities are going to keep on coming. With the American Heart Association by my side, I'm ready for them, because we live fierce.
Good afternoon and welcome to the 2021 New Hampshire Heart Ball. I'm Audra Burns, Media Relations Manager at Dartmouth Hitchcock and longtime AHA volunteer. And we are here to celebrate life, to toast to vibrancy and love and all that is unique and resilient in our community. We are here because of the work of the American Heart Association. It has transformed lives of our neighbors, friends, and loved ones. I want to thank you all for showing up today and every day to support the American Heart Association. It is through relentless supporters of you, our donors, our sponsors, and our volunteers that we are gathered here for this hour to show the love, feed the soul, and come together because we are a force for a world of longer, healthier lives. We are the heart of New Hampshire, and I could not be more thrilled to be part of this mission. In spite of a year of challenges, it's incredible to learn all about that has been accomplished. Before we get started, our work is only made possible thanks to our sponsors. We would like to give a huge shout out to our local sponsors, Cross Insurance, Catholic Medical Center, and to our local media sponsors, New Hampshire Business Review and New Hampshire Magazine. All right, so let's kick things off this evening by having some fun and getting interactive in the chat box. Check out the toolbar along the bottom of your screen. What you'll need to do is click chat on your toolbar to open up the chat box. And then from the drop-down menu, be sure to select all panelists and attendees so your comments can be seen. Let's try it out. Type in the name of the town that you are from so that we know where everyone is joining us from this evening. I'm joining you all from Merrimack, where I live with my husband, Tim, and two sons, Grayson and Cameron. Let's see who we have here. Oh, we have someone here, Elizabeth from Portsmouth, welcome. Concord, I'm seeing, oh, Massachusetts. We have some coworkers up from our Dartmouth Hitchcock Heart and Vascular Center. Thank you so much for joining us. We have June from New Jersey. Check it out. We're spreading heart health across the country. This is great. We have Robin from Amherst. This is fantastic. Thank you so much and welcome and for joining us. So you can also turn off the captions by using the toolbar at the bottom of your screen. Simply select live transcript and then hit subtitles. Lastly, don't forget to post those heartbell selfies to Facebook, Twitter, or Instagram using hashtag #LifeIsWhy so we can see all of you in your heartball finest. We've planned for what I hope is an inspiring and informative hour for you. And I'm sure that all the women out there might agree that there are some perks to having these events now virtually. And I'll tell you one of my favorite, and that is that I do not have to wear these shoes to an event. I am currently barefoot sitting at my desk here in Merrimack, coming to you from the Heart Ball. I'll tell you, these are not very comfortable to walk in. So kudos to the virtual event. And I hope you guys are equally as comfortable this afternoon. So we're going to be meeting a brave heart survivor in just a moment and hearing from one of our local cardiologists. And most importantly, you will have the opportunity to open up your heart and make a life-saving gift to the American Heart Association. Now we've come to a very important part of our program. I would like to introduce to you this year's survivor speaker, Golda Black.
I am a mom of 3, and I've been married for 7 years. I am the youngest of 5 kids. I'm my dad's youngest daughter. He didn't want me, and I'm his favorite. Josh and I met 11 years ago.
It was love at first sight.
Everything was falling right in line. We had our son first, which was exactly what I wanted. Then we had our little girl, and then we had Cooper, and our family was complete. Yeah, and then everything changed.
So one thing I can say is that we did have it all. We thought this is what we wanted, but an event like this, you care less about anything else. Everything you thought was your dream is no longer the dream you want.
I knew that I was really sick during my pregnancy with Cooper. I'd had symptoms really after the birth of Luella. I started having a lot of dizziness and I was lightheaded all the time. So I finally went to an urgent care, and the urgent care doctor kept telling me that it sounded like I had asthma. He couldn't imagine that I had not been diagnosed with asthma before. So he did an x-ray to rule out pneumonia, and it showed that my heart was enlarged. I made a cardiology appointment that next Monday. I was like, I'm not messing around anymore. Somebody's gonna figure out what's going on. I've been sick for too long. I went to the cardiologist appointment, and as soon as he walked in, he looked at me and said, "You're too young to have something wrong with your heart." He said that he would do an echo stress test to prove to me that there was nothing wrong with me. I went in for the echo stress. As soon as I sat down and she started the echo, I knew something was wrong. She says, "I'm really sorry, we can't put your heart under any stress." She said, "You have a reduced ejection fraction." I called my husband, told him that everything that I'm Googling is telling me that I'm in heart failure. And if my number's above 30%, that I can recover from this.
I knew something was wrong. Sorry.
The doctor called me back from his cell phone and said, "I'm really sorry. I know why you're feeling so puny. You have what we call peripartum cardiomyopathy. You're in chronic heart failure." And I said, "What's my number? What's my ejection fraction?" And he said, "You're at 15%. My husband was on the porch and he was just sobbing uncontrollably. And to see your husband cry is absolutely one of the hardest things, because you know that it's serious then. You know that you're not just being dramatic anymore. This is serious.
I'm a mechanic, so I can fix just about anything. This I can't fix. There's nothing I can do.
When I went to Christ, I met Dr. Chung, who I absolutely adore. He told me how serious it was and what we could do, and what my options were and the recovery time. But he also was very honest with me and told me that the likelihood of me recovering was very slim. I'm strong, and when you have kids, you do what you have to do, and you get better, because at the end of the day, all I'm asking for is more time to raise my kids. Worst case is I crash and I don't get any better. They hook me up to an LVAD in the hospital and I wait for a transplant. Best case, I live like this for 20 years. I stay on medications, I take care of myself, I eat healthy, I exercise, and my heart holds out. And then I worry about, in 20 years, what's going to be different then? What has research and funding gotten us then? When I look at my kids, all I think about is if I'm not there on their wedding days and the day they graduate and the day that they have kids. You know, when you have kids, your mom is like your number one person that you depend on, and I don't have that, so I need my kids to have that. I need Luella to, have her mom.
Hopefully, people continue to support the vision of the American Heart Association.
I'm 30 years old, and I really feel like there's hope that with research and funding that is just going to keep getting better, and there's going to be a light at the end of the tunnel. I'm just trying to fight for the future and fight to raise my kids and make a difference and raise awareness so women know that this can happen, that you can look perfectly healthy on the outside and be dying on the inside.
My vision for the future is that, things get better. Her heart can last long enough till technology catches up and, something can be done.
I just am trying to get every last beat out of this heart that I can get out of it before I trade it in for something new. I have high hopes that the American Heart Association's research will make my vision a reality.
Good afternoon, everyone. I'm so happy to be here with you all today. I'm going to try not to cry. You would think after seeing my own video 4,000 times I'd be okay, but I'm just so happy to be here with you guys today, and so thankful for this opportunity to share my story with all of you. It has been a few years since we filmed this video, which is why I get so emotional, because my little babies were so small, and now little Cooper is graduating kindergarten tomorrow and Walker is off to middle school. But that is neither here nor there. We've had so many highs and so many lows since I was diagnosed, from almost being placed on a transplant list to new medications and clinical trials, and the list goes on. But thankfully, because of these advancements in science and my love for my children, and maybe a little fortitude on my end, I am still here for all of these milestones and still very stable. I haven't quite made a full recovery, but I am still here. But that is not the only reason I am here today with you all. I want to talk about why we're all here, and that is the mission of the American Heart Association. When I got involved with the AHA, I was heartbroken in every sense of the word. I had Googled every statistic there was to Google. And even though I felt so incredibly alone in my diagnosis, I quickly realized that I was not alone at all. Women are dying of heart disease at an alarming rate. Women are disproportionately affected by heart disease, and we are still underrepresented in clinical trials. But this organization, all of you, we're changing that. How can I not want to be a part of that? At the end of the day, we all have our why for giving so generously to the American Heart Association, and I have 3 of them: Walker, Luella, and Cooper. They need their mama, and I need to be here to raise them. From day one, my fight has been for them, and I will continue to fight for them. I want to thank the American Heart Association for allowing me to share my story, and thank you to all of you for attending the American Heart Association New Hampshire Heart Ball. For me to keep living, everyone must do their part. I have to exercise, eat well, stay healthy. My doctor has to provide excellent care, and scientists need to continue their research to develop their next advancement that will give me more time on this earth. This is why research and funding is so critical. You can play a part in making this happen as well. I'm asking you to please open your heart. My goal is to have my ejection fraction at 50% at my next echo. Would you consider a donation of $50? Or if you're able to help support research, $125, or a $250 gift in honor of your why? We've made it really easy. you can text NH Heartball to 41444 now to donate from your mobile device. I already see some donations coming in. You guys are awesome. Audra, thank you. Thank you to Jonathan and Robin Edinburger. Did I say that right? Yes. I want to thank all of you from the bottom of my heart. With your love and commitment to the American Heart Association, it gives me the continuous hope that I desperately need. Thank you, guys.
Wow, Golda, thank you so much. That was incredible. And now I have to share, the second positive thing about having an event like this is that all of us could ugly cry behind the scenes without you knowing, because that was incredibly touching and I think so important. And one of the things that really hit me was that in the beginning of the video, you talked about how you were normal, quote unquote, normal, healthy looking on the outside, but you had no idea what was going on the inside. So can you share your thoughts on how important it is to know about, family history that people might not be aware of?
I think knowing your family history is so important. What a lot of people don't know is I actually do have a genetic mutation. My grandfather passed at 30 years old from the very condition that I have now. And my oldest son has the same genetic mutation as well. And, knowledge is power. Since we know that Walker has this condition, we can watch him very closely and he will never become as sick as I did. So since we know, we can treat it before it ever becomes an issue. So it's 2021. It's a great time to have heart disease, if you will, for lack of a better term, I guess.
And we're working to eradicate that for sure. And before you go, what advice do you have for other young women who, they might be feeling a little off in their body, or they might not be sure what it potentially could be if something's wrong? What advice would you tell them?
I definitely just think it's so important to be your own advocate. You have to push for answers. You can't take no for an answer. And you have to listen to your body. I think that's the number one thing.
That's crucial. Well, thank you so much for sharing your story. Truly appreciate it. And good luck with your son's kindergarten graduation tomorrow. Congratulations,
Thank
Mama.
you.
And
Thank
take
you so
care,
much.
Golda.
Thank you.
So you can see how important the American Heart Association's mission is to families like Golda. If you are able to, we hope you'll consider donating. Giving today is easy. Simply text 41444 with the message NH Heartball. Our goal this afternoon is to raise $10,000. Let's see. Oh, Tracy Pelton, thank you. Brian Shanky, Trevor Cook, Kayla Gomez, Nancy Vaughn, Jonathan and Robin Enniger, thank you so much. And as you can see, my name's on the board as well for donating. And I actually donated, as you can see, I have neon pink nails. And the reason why I have neon pink nails is because I didn't need to go to get a manicure. And so what I did was I donated that because I think that's important to be able to donate back what little that we can. So any little bit helps. So to be a relentless force for a world of longer, healthier lives, we have people like Chris Bond who is supporting us. Thank you so much, Chris. Look at all of these coming in. This is fantastic. We're up to over $6,500. It's so simple. Just text NH Heartball to 41444. It's so simple. We are so close to getting up to that $10,000 goal. This is excellent. What a great Tuesday afternoon that we have going on here. I love it. I love it. So to be a relentless force of a world of longer, healthier lives is the mission of the American Heart Association, and a mission that is critical today as it has ever been. Why is that? We know that heart disease continues to be the #1 cause of death and has not taken a break during the pandemic. Many of you have been touched by cardiovascular disease, and all of us have had our lives changed by COVID-19. We all know that heart and stroke patients are at higher risk for COVID-19 and than the general population. They make up 40% of those hospitalized for COVID complications. It's encouraging to know that during the past 12 months, the American Heart Association has committed $2.5 million to COVID-19 research to investigate the cardiovascular implications of COVID-19. They have developed an online registry for hospitals to capture clinical data, vitals, and cardiac biomarkers in COVID patients to track outcomes and provide better care for now and the future of cardiac care. And as an employee of Dartmouth Hitchcock and our Heart and Vascular Center, that's crucial for the work that we're doing. They've produced podcasts and videos that led medical staff to save more lives by up-to-date information that they're learning on the vascular impact of COVID. And they focused on advocacy efforts to help combat health inequalities. We are inspired that each of you share this passion by joining us here today. So it is my pleasure now to introduce you to our keynote speaker, Dr. Jonathan Ettinger. He is a staff cardiologist with Catholic Medical Center and a longtime American Heart Association medical expert. He joins us to present Doctor, It's Been Too Long, and to share how the pandemic has and is still affecting our heart health. Following Dr. Ettinger's presentation, he will be available to answer your questions. You can simply ask your questions in the chat box, and we will discuss afterwards. Welcome, Dr. Ettinger.
Hi, Audra. Thanks for that wonderful introduction. I really appreciate it. It's always been a privilege to volunteer for the American Heart Association. I've done that for a number of years, and I'm proud to be a member. Thanks. It's an honor to be asked to speak today. So the American Heart Association's top priority is the health and well-being of our society through the prevention and treatment of cardiovascular disease. I didn't really anticipate how the American Heart Association's mission would merge with the pandemic and the fight of the pandemic until we started seeing patients come into the hospital and seeing the complications that they were having from COVID. I'm going to tell you a few stories from the hospital and also give you an idea of how the American Heart Association has merged its mission with the eradication of the COVID-19 pandemic. So the pandemic affected people in a way that we couldn't have predicted. It was emotionally draining from the isolation. The mental health issues that have developed were and continue to be very challenging. We saw unhealthy habits picked up over the past year, and it took an incredible physical toll on people as well. The fear of coming into the hospital caused people to miss their annual physicals and their specialty appointments. In my office today, I saw two people who I haven't seen from 2009 until prior to the pandemic, 2019. I actually saw one person last week from 2018. So we're still trying to get back on track. The hospitals and health systems found themselves struggling to maintain everyday balance in the middle of this brutal virus. It's caused a financial strain that's everybody's been trying to endure and get out of. It forced us to be nimble, to think outside of the box. It's really forced us to rely on things that I think we took for granted and appreciate those things more. One thing I want to talk about in terms of heart health is what we saw early on in the pandemic. Probably in March or April, as we saw people afraid to come to the hospital, we actually started to see less heart attacks and strokes come through the emergency room and into the hospitals. And this was going on nationwide and worldwide. And because of people sitting at home, we ultimately, we saw people come in late with their heart attacks and with their strokes. And we saw complications from these heart attacks and strokes that we hadn't seen in decades, quite honestly. I think we've been so good with missions and statements like the American Heart has put out in their drive to curb heart disease. We've been so good about people coming into the hospital at the beginning of a chest pain syndrome or the beginning of something that seemed not right or unusual, that we treat their heart disease very early. And we've benefited from that. But what we saw during the pandemic early on, as I mentioned, is we saw these really awful complications and even deaths that were unnecessary. So we lost lives, and it was premature. And the American Heart Association, as part of their efforts during that time, right at that time, started a campaign called Don't Die of Doubt. That, in combination with media outlets and editorials in the newspaper and just social media, the power of that, we were able to spread the word that we're still open. You still need to come to us. Don't sit at home and sit through these questionable processes and end up regretting it. So thankfully, we came through that in the spring and were able to get people back on track. Excuse me. In addition, we saw chronic medical conditions that were allowed to get worse in the face of weight gain and diabetic control that started to go awry. Blood pressures, isolation, mental health issues all contributed to worsening chronic risk factors for cardiovascular disease. And we're starting to see people come back to the office now, and people come into the hospital now with the effects of those chronic medical conditions that have been allowed to slide and regress. We even saw people start smoking again, just out of the isolation and the boredom and the stress. And it's understandable what people have been going through. As we begin to reopen society, it's really time for you to start focusing on your health and to take on the challenge of being healthy and strong. This is where we need people to show resilience, and where, even though we're on the other side of the pandemic curve here, this is going to be a marathon. What India is dealing with right now is devastating. And you're seeing variants over there that we don't have an understanding of yet that could take a foothold elsewhere. They're starting to spread. I remember coming to work one day, and probably it was like April or so, right at the height of some of our worst times. And there were people lining the street with signs in support of healthcare workers. It was really awesome. They were out there for their families too, who were in the ICU, some of whom had to die in the ICU without their family around. It was brutal. And there are many stories of hope and heroism that we've heard, and we've been able to come together as a community, and local and nationally, and seen a lot of resilience. Individually, what we need is for you to embrace that, those stories and that hope, and to get back to the routine that makes you strong, that gives you courage to start battling back during this time. I had a woman in the office today, 75-ish, haven't seen her since 19, silvery hair, spunky thing, dyed her hair purple. Right, just awesome. When I asked her why she did that, she's like, because it allows me to feel alive, is what she told me. Allows me to feel alive, right? I don't need everybody to dye their hair purple, but I need you to try and find something to embrace you, to find something that makes you courageous and strong, whether it be re-engaging with your friends and family smartly, of course, socially and smartly. And I also need you to re-engage with me and my colleagues. Your health is our concern, and we want to welcome you back. There are plans in place for you to come back. You'll see when you open your hospital website that there should be information for you about how the hospital is going to look and what the plans are to keep you safe as you re-enter the hospital system. That might include screening at the door. It might include fever checks. You're going to see us in gowns and masks. We're still taking the virus seriously. in terms of protecting ourselves and protecting you, because we're still dealing with hospitalized patients, albeit a smaller number right now. If you're uncomfortable with meeting in the office, one of the silver linings of the pandemic has been our ability to have telephone and telemedicine chats that have been really powerful. Yes, they're limited in certain ways, but all in all, it allows you to connect with us and stay engaged. It continues your treatment plan, allows me to refill your meds, simple things that continue to lower your risk over time. Later on in the talk, I'm going to dive in a little bit on some of the risk factors for cardiovascular disease that have been allowed to progress. Obesity, diabetes, congestive heart failure, high blood pressure. These have all been syndromes and conditions that have progressed over the past year and a half or so. The good news is they're reversible. We can begin to, excuse me. We can get a handle on these and begin to reverse them. The data and the studies are showing that these conditions are high risk for COVID complications, meaning if you get COVID and you have these conditions, your likelihood of doing worse with the COVID is higher than if you don't have those conditions. Now, there's a lot of variability within that. That's not meant to scare or to threaten. It's just meant to inform so that you can have a meaningful discussion with your provider about what the risk might be and what you can do to adjust that risk. It's also important to talk to your provider about the vaccine, because the vaccine for COVID-19 is what allows you to stay safe from COVID now. It's going to take a while to reverse those risk factors, but getting a vaccine will really minimize your risk for complications from COVID. Most of you might know this, but nobody died in the vaccine trials after getting the vaccine, right? Really powerful data, very powerful data. It protects you and your family. It allows society to reopen safely. There's a solid percentage of people out there that are hesitant about this as well. And they're hesitant, but they're still curious, I guess I would say, right? So if you're in that camp, I need you to think about your fellow man and the person next to you, the bus, the train, the cafe. Think of your older loved ones, your younger loved ones. The reason why we get the vaccine, if you're relatively healthy and you're thinking, why me? I'm not going to get sick. That might be the case, but your vaccine suppresses your likelihood that you get the virus, and will most likely limit your ability to transmit that virus to someone else. And if I can't transmit it, then the virus is not going to be able to get a foothold in society. It's not going to be able to get a foothold in the population. And at that point, if it's not able to replicate, then it won't be able to mutate. And if it can't mutate, it's going to gradually die off. This is the power of herd immunity. Herd immunity. Okay? It's been a buzzword, but that's the concept. It protects those that are susceptible, the most susceptible to disease. So when I get a vaccine, that allows me to protect somebody else who might die from COVID. That's how you should start thinking about it. If you're wondering how it's going to benefit yourself, it might not benefit yourself as much as it benefits somebody else. Ultimately, though, it will benefit you in the long run as well. It's safe, it's effective. There's been a lot of messaging out there that's been confusing at times. It's been overwhelming. It's been hard as a clinician to digest it all as well. And I agree, sometimes it's been confusing, the messaging changes, but that's the message today. The vaccine is safe and effective. And that's been a message that we want to continue to provide, and healthcare providers want to continue to provide to get us through this. It's essential for those most at risk, those who have established cardiovascular disease, those who are older, people of color, Blacks, Latinos, Native Americans, rural communities, all disproportionately hit by the virus. The vaccine's essential for you as well. So don't delay, make an appointment, set your heart on it. Okay? When it's your turn, get the vaccine. There's a nice branch of the American Heart Association website, www.heart.org, heart.org/pandemic. That'll give you more information on this as well. So I want to transition into some of the chronic conditions that have been allowed to flourish and have accelerated the risk for heart disease. One is obesity. Obesity is one of these dirty little words that we don't like to talk about. But as clinicians, we don't use the word because we don't like to stigmatize people. People don't like to use the word either. It's a difficult word to hear. Nobody wants to hear that they're obese. But it's important to have an open dialogue about weight and weight management. One of the ways that I've kind of tried to break the ice with people is by likening the COVID-19 to the freshman 15 that we sometimes hit when we went through college, and we had that explosion of, oh my God, I can eat and do whatever I want, and then realized, oh my God, I can't. There are consequences of that. So that's what I tend to use, and it tends to be normalizing for folks, and it allows us to talk a little bit more realistically, because I would say the majority of the people I've seen in the office haven't been able to lose weight during the pandemic. A few have been able to maintain, kudos to them, right? But a lot of folks have gained weight. So this is the conversation I'm having in the office on a regular basis. And we talk about barriers to achieving weight loss. And this is where you start getting into your ability to change, right? What are the barriers that are going to limit your ability to change? Is it my knee? Is it my schedule? Is it work? Is it something else that I can strategize with my provider around to try and get at how to best lose weight? It might be that I need a program or a medication. We've got a couple new great medications that are out there to help with weight loss. There are fantastic programs across the community that are low cost or no cost. Your health systems have programs in place to help deal with this. I know both Dartmouth and CMC have those in play. So reach out to your local community center, health system, gym, and start to inquire about ways to do this at low cost or even no cost if that's possible. Hypertension, high blood pressure. This is the #1 risk factor for stroke. It's exceptionally common. So over 30% of people are hypertensive in the United States. And and for example, for African Americans, it approaches 40%. So it's a major risk factor for cardiovascular disease and stroke. It's also been allowed to creep on us over the pandemic. Things like weight gain, alcohol, inactivity, diet, all contribute to high blood pressure. The good news is that all of that stuff is reversible, and we can see the benefits of that in terms of the blood pressure pretty quickly. Losing weight, curbing the alcohol, getting off the couch, and changing the diet in ways that are meaningful. And this doesn't have to be some acute change. It needs to be something that's durable and lasting over time. So I often talk about making small changes with patients and keeping things in perspective, that this didn't happen overnight. It didn't happen in a day or two. It happened in 18 months to 2 years. So it's going to take time to unravel all of that. Diabetes, same thing. Inactivity, weight gain, all contributing to elevating the blood sugars, also controllable, also reversible. Doubles the risk for cardiovascular disease and stroke. Cholesterol, it's all part of the same package. Weight goes up, diabetes goes awry. Inactive, strong risk factor for cardiovascular disease and stroke. Will come down with changes in your lifestyle, changes in diet. Now, it might be too that your provider is so concerned about your risk that some of the behaviors will take a while to unravel and to correct. And so there might be a medication change or a medication adjustment or an addition to your medication regimen to protect you during this time. Hopefully some of those conditions reverse in a way where the medications can be decreased or even go away. So that should be the carrot for you, is to try and get rid of some of these meds, trying to feel better, trying to reduce your risk of heart disease. It's hard to prevent the problem that you've never had. But, I will often see people in the office, and I'll joke with them that you don't want to see me in the hospital. I'm the guy you don't want to see, right? Maybe you do, but honestly, people don't want to see the cardiologist in the hospital because that means they've had an event or something's happened to them. They don't want to, you want to meet me outside of the hospital. You want to address your risk factors outside of the hospital so you don't have to come in with that cardiovascular event. These conditions get into a new paradigm of health that we call cardiometabolic medicine. So you're going to be hearing more about cardiometabolic medicine in the literature. This is a discipline where we see all of these risk factors come together in a way that become more powerful than they are individually. So if your risk with diabetes is 1 and your risk with high blood pressure is 2, then it doesn't add up to 2, it adds up to 3, because these risk factors are synergistic. They play off each other. The nice thing is attacking one of them also tends to correct multiple of them. Okay, so there's hope here. These are reversible. We're worried about the long-term effects of these. We're worried about the long-term effects of COVID as well. We're still trying to figure out long COVID. It's going to take a while to sort out the effects of having COVID. New Hampshire's done a really great job with the vaccine. We're now up over 70% of people have at least 1 injection. That's fantastic. There's only 7 other states. We're one of 8 as of yesterday, according to the CDC. We're one of 8 states to have over 70% of people. Kudos. I feel like I'm talking to the choir here, but this is the power of the community, is you can talk to people who, who might not be unwilling to get it. They're just hesitant at this time. Talk to them. Tell them it's safe. It is uncomfortable. My wife and I, maybe 24 hours to 48 hours of just feeling kind of flu-y and not great. But the benefit for that is it is far reaching. My son, 13, Jackson, he's actually excited to get it. He's seeing his friends online getting it. They're doing well. He's happy to participate in this as well because he knows he's impacting society. So take care of your health, re-engage with your provider and your health system, reconnect with yourself, do the things that you need to do to change your behavior, get that courage back, find the strength you need to start changing your risk factors for heart disease. Get the vaccine, reduce your risk of COVID, reduce society's risk of COVID. Thank you.
That was great. Thank you so much. That was so informative.
You're welcome.
And it's really nice to see you again. When I used to work at the Heart Association, it was nice to be connected to you and have you as a medical expert. And you've been doing great all these years by continuing to talk about heart health. So thank you very much for that. One thing you touched upon was the fact that, you're not seeing patients coming in, or if you are seeing, it's too late. They're already advanced with their heart disease, or they could be in the midst of a stroke. So could you talk a little bit about, why is it important if people are suffering at home with symptoms of your heart disease or stroke? Why is it important for them to call 911? Is there any early interventions that could possibly happen quicker that might trigger them to want to get medical help instead of just waiting at home?
Yeah, that's a great question. I mean, part of it is related to just the medical benefit. Like if you get if a provider, emergency medical services can get out to you soon, they can begin the treatment for heart disease right there and then on the spot. And then they can alert the system and activate it. We call it activating the system to get ready for you to come into the hospital. That time is important for us so we can quickly turn around our teams and turn around the testing to get you the best treatment you need for both stroke and what we call a myocardial infarction, heart attack. Both of those are time dependent. The longer the process goes on without therapy, then the more likely you are to suffer permanent damage. So 911 is key, both for your short-term health to make sure you survive the event, and also your long-term health so that you're able to recover from this without a lot of disability. As well, you don't want a spouse or a loved one or a friend driving you to the hospital and something happens to you in the car. They have no way to deal with that. That's a lot of burden for them to bear. There could be a safety issue as they try to help you. So there's a number of reasons why to just call 911.
Yeah, excellent advice. We have one of our first questions coming in, and they're asking about what are some simple steps that I can take to make my heart healthier? What are the simplest ones that you would give for a suggestion?
Well, I think as part of getting back into the hospital system and getting back to your provider, it's knowing your numbers. As part of that office visit, most of us haven't had lab work done in over a year. So that would be a good start. It would give a sense of your cholesterol, your blood sugars. We're going to check weight and vital signs, things that are vital. And then we can have a really informed discussion about things that we can do to modify the risk. Most people know what their risk factors are as well. So you could start to make some of those changes at home, whether it be, eliminating that snack or adding a vegetable to the meal, fruits and vegetables with every meal, right? We try and incorporate that. Simple things like that aren't too overwhelming psychologically or emotionally, but might be able to make a small dent in this shift in our lifestyle.
Mhm. And I think we have one of our viewers who actually made some small steps. So shout out to Mary Ann who started walking. She shares that she started walking and started lowering her blood pressure and started feeling good. So that's a great example of small step. So thanks for sharing that, Mary Ann.
It's awesome, Marianne.
So what are here we have another question. What are the most important things to ask my doctor at my first appointment back? That's a great viewer question.
Yeah, this is one of those ones that you might need to individualize depending on your chronic medical conditions. But you could start by just asking them the simple question, what is my risk? One of the great tools that I have in cardiology is we have a lot of calculators. We call them risk calculators that the American Heart Association has been very instrumental with the data and help pulling together these calculators. But I can plug in all your numbers and get a sense of what your 10-year risk and what your 30-year risk is for heart disease. And then based on that risk, that's a nice platform for me and my patients to have a discussion about how to do this. What are we going to do to start to lower that risk?
Mm-hmm. Yeah, it's one of those numbers that you don't want to hide from them. You can't hide from them, right? Once you put them out there and you're able to make a judgment of how you can start on the path to heart healthy living. So certainly don't try to hide from those numbers, because once you know the numbers, you can make the change. So we have another question that was submitted from one of our viewers, and it is, I've been pretty good about taking care of my physical health during the pandemic, but how important is mental health to my heart health?
Oh, so mental health is critical. This is where we have a real dearth of literature, a real paucity of literature. There just isn't a lot out there on the long-term effects of stress and mental illness on cardiovascular disease. We have some cardiovascular conditions that are significantly impacted by short-term stress, but long-term stress, it's real difficult. We think that depression is associated with risk for heart attack, particularly if you've already had a heart attack. Your depression after a heart attack is another risk enhancer, if you will. So one of the things we try and screen after an event is how you're doing with your mood. And if it's something that you're struggling with or something that needs attention, then usually it's a combination of counseling and medications to help lower that risk again. Mm-hmm. And it is a big issue. We just need more attention to the mental health side of cardiovascular disease.
Absolutely. But mental health in general. And I think that, sometimes you can do something that's active that makes you feel good, and that's going to benefit you as well on the mental health side. It's going to make you feel better. So like Mary Ann started walking, just take those small steps and it might actually start improving your mood as well.
That's a great point.
I think one thing would be great to talk about briefly is, because you mentioned strokes earlier, what if people are at home, like we're all at home, a lot of remote workers now, this is my office now that I get to work from, but a lot of us are, permanently home. So when we have, when someone might experience a stroke, what signs should they really be worried about and thinking about if they're sitting home alone? what signs of a stroke should they be watching out for so they know to call 911?
Right. That's a great question. So the American Heart Association has a mnemonic that I love. It's called FAST. FAST. The F is for face, so facial asymmetry. You might have seen people might have seen pictures of the droop that you get in your lip, the eye that's kind of more open than the other eye. Facial asymmetry. Arm, can't move my arm. Right? Kind of flaccid, if you will, unable to just move it in any direction. Speech can become affected with a stroke, is the FAS, and then T is really time. At that point, when you have any of those symptoms, you want to start thinking, this is where I need to call 911 and start to, as I mentioned, activate that system and get in there.
Yep, that's really great. And I think too, we can all, so many of us live on Zooms these days that we can also be stroke watchers. If we start seeing a coworker on screen who might be experiencing one of those symptoms, because like all those symptoms you mentioned are very visual. So if you start seeing someone experience, then pick up that phone and help save a coworker too. That would be great. So you've shared some excellent information and we're almost out of time. And I would really love if you could give, two really important pieces of information that you want as takeaways so that our viewers starting tomorrow can live heart healthy. What would those two crucial tips be?
Right. So I think one crucial tip would be just to re-engage with your healthcare provider and get your numbers, start to know your numbers, because that's really going to be a powerful piece of information for both you and your provider to understand what your risk is and then to begin to lower it. So that would be one. And the second one is really just to get the vaccine. If you're still hesitant out there, it's safe, it's effective. It's something that would be a nice discussion point with your provider as well. So you can delve into some of those issues that you might have around it. And then your provider and you can hopefully share some information that helps you understand what the risk of getting the vaccine is and move you closer to being immunized.
Excellent. Well, thank you so much, Dr. Ettinger. Important information. Always a pleasure. Thank you so much.
Thanks a lot, Audra.
So let's take a quick peek because we still have just a few more moments and we would love for you to still give to the Heart Association by texting NH Heartball to 41444. Let's get one last look to see how we're doing. Excellent. Look at that. We're moving up. We're moving that thermometer closer up there. $6,711. That's fantastic. That's all going towards supporting heart disease research and education. I love seeing all these names scrolling on here. We can't thank you enough for the important work that you are supporting by donating to the American Heart Association. So we are the Heart of New Hampshire, and I'm proud of our community and of this amazing organization. The American Heart Association, they impact us in some ways, all of us in some ways, and the health and well-being of all of us who live here and so many across the country and around the world. I thank you for an incredible afternoon, and I look forward to being back together in person sometime. Take care, and thanks for joining us.
Had to have high hopes for a living, shooting for the stars when I couldn't make a killing. Didn't have a dime, but I always had a vision, always had high hopes. Had to have high said, don't give up. It's a little complicated. All tied up, no more love. And I'd hate to see you waiting. Had to have high hopes for a living. Shooting for the stars when I couldn't make a killing. Didn't have a dime, but I always had a vision. Always had high hopes. Had to have high hopes for a living. Didn't know how, but I always had a feeling. I was gonna be that one in a million. Always had high hopes. Mama said, something for oddities, stranger causes. Ain't ever wannabes, waiting the novelties that don't ever change. We wanted everything, wanted everything. Stay up on that rise, stay up on that rise, never come down. Oh, stay up on that rise, stay up on that rise, never come down. Mama said, don't give up. It's a little complicated, all tied up.